Welcome to another edition of CCH Checkup brought to you by Carroll Community Hospital. With February being American Heart Month, today we are talking about heart disease in women. Joining us, we have Dr. Jundi of Covenant Center for the Heart. Thank you for joining us.
Thank you so much for having me.
What are the differences in heart diseases between men and women?
There are certain differences in heart diseases between women and men. To start up with the coronary artery diseases, also people know about blocked arteries or having heart attacks. Normally women have the onset of coronary artery diseases 10 years further than men, and usually the age is 55 versus 45 for men. The characteristics of the pain or the symptoms in women is a little bit different than men. For example, the chest tightness is more common in women than men. Is the atypical presentation. The unusual presentation is more common in women than men, and that will lead sometimes to later diagnosis of heart attack or more of a silent heart attack in women comparing to men. Also, women have more of other diseases that they have it comparing to men. For example, the broken heart syndrome is very common in women comparing to men. And also what people know about syndrome X is the small vessel diseases of the heart. It's more common also in women comparing to men. That makes the diagnosis of these diseases a little bit difficult, and usually women seek help from professionals later on rather than men. Most of the times when they seek help, the presentation might fool some of the physicians and lead them to think about other diagnoses. For example, women when present sometimes with atypical symptoms like chest pressure or what we call pain in the abdomen, and that can represent coronary artery disease or acute coronary syndrome, and they will be having a heart attack, and people will start thinking this is an abdominal pain rather than a cardiac presentation. So women tend to have later or delayed presentation or diagnosis for these symptoms comparing to men, who they present sometimes with the typical what we call angina chest pain, and they will be diagnosed with coronary artery disease.
I think we covered everything right there, so I want to thank you once again, Dr. Jundi, for joining us today on CCH Checkup.
Thank you so much.
And as always, for more information, you can visit cch-mi.org.